Good morning, everyone. I'm Patrick Gaspard, the president of the Center for American Progress. And on behalf of CAP, the Leadership Conference on Civil and Human Rights and Community Catalyst, welcome to today's event. Just a little bit of housekeeping at the start. I want to tell you that live captioning is available for this event. And to access it, just click on the closed caption button on the bottom of your screen. Now, this is my very first time opening an event at CAP. I'm thrilled to be here and thrilled to have such an exciting and distinguished panel ahead. But first, I'd like to do just a little bit of table setting and context setting for this terribly important topic. I always think that as an organizer that it's terribly important to center the actual lived lives of those who are benefiting from the policy positions that we are championing. So today in this conversation, I want to lift up and center the experience of a remarkable woman by the name of Adrienne Gunter, who hails from Philadelphia. Adrienne is a woman of color, a storyteller, a lover of the arts. 6 years ago, at the age of 30, she was diagnosed with multiple sclerosis. In the wake of her diagnosis, she applied for Medicaid, not once, not twice, but 4 times. She was rejected each and every time. It was only when Governor Tom Wolf expanded Medicaid coverage in her state that she was finally able to get the insurance and the care that she needed. That single act of leadership more than halved the uninsured gap between Black and white adults in Pennsylvania. And it also meant Adrienne could get the treatment so that her condition would not get worse. Without Medicaid expansion treatment and medication, it would have cost her thousands of dollars. But with Medicaid coverage, it cost her nearly nothing. Her doctor's appointments covered, her MRIs covered. If she breaks a bone or falls, that is also covered. If she has a poor response to her medication, that's covered as well. As Adrienne said, this is a condition that she's going to have to live with the rest of her life. And she deserves, and all Americans deserve, to have treatment and support in these moments in the wealthiest country in the history of humanity. Unfortunately, there are many Americans in the same position as Adrienne who don't receive this basic, simple, humane coverage because of the state that they happen to live in. 12 states have not expanded Medicaid under ACA. And as a result, over 2 million Americans are uninsured and who are caught in that coverage gap, where they don't qualify for Medicaid because their state has chosen not to expand the program, and they also are not eligible for financial assistance from the marketplace. Recent analysis by the Center for American Progress has found that closing the Medicaid coverage gap would save over 7,000 lives per year. It would also result in almost 50,000 fewer evictions and a $2 billion reduction in medical debt because those currently caught in the coverage gap would become more financially stable. That's not to mention that permanent closure of that gap would also better serve millions of other Americans like Adrienne who experience chronic illness. It would also improve continuity of coverage to give Americans better health and economic benefits. And it would address, as President Biden has said we all need to, it would address the racial coverage gap as well. 60% of those who fall into that coverage gap are people of color. A comprehensive, permanent policy to eliminate that gap would go a long way in closing those disparities. Now, governors and state legislatures have been given every single incentive after incentive to expand the program. Under the ACA, when a state expands Medicaid, the federal government pays 90% of the cost for newly eligible beneficiaries, regardless of the number of enrollees. And the American Rescue Plan added even more federal funding for that expansion. And yet, right now, to this day, governors and state legislatures are refusing to act. You know, when I think of the anguish that Adrienne must have felt 4 times in a row when she denied coverage, it tells me exactly why we need to act and why we're having this conversation today. It's beyond unacceptable. With the president's reconciliation bill, we now have an incredible opportunity to get those low-income, uncovered Americans covered. And that opportunity is due in no small part to the perseverance, the endurance, and the courageous leadership of leaders like our representative, James Clyburn, and organizations like the Leadership Conference on Civil, Human Rights, and Community Catalyst. Now, I'm going to end there, and I'm introducing Emily Stewart, who leads Community Catalyst, and she's going to moderate this conversation. But I have to just mention the leadership of my friend, Wade Henderson, who's been extraordinary in this moment and over a lengthy period of time in helping us to build a more perfect union. So thank you all, and I turn it over to you now, Emily.
Thank you so much, Patrick. And we're now going to turn to a conversation with our esteemed guests, Representative and Majority Whip James Clyburn of South Carolina, and Wade Henderson, the interim president and CEO of the Leadership Conference on Civil and Human Rights. Well, we all know Representative Clyburn, not only as a Democratic leader, but as a national leader. He has been in Congress since 1993, representing South Carolina's 6th congressional district, and he has always been a powerful influence, serving as chairman of the Congressional Black Caucus, as well as vice chair and later chair of the House Democratic Caucus. Representative Clyburn is known for using his position in Congress to champion issues of racial equity and for rural and economic development. Just one example of this is his 10-20-30 formula for prioritizing underserved communities, which was included in the 2009 federal stimulus program. That formula requires that 10% of appropriations must go to communities where 20% or more of people have lived at or below the poverty line for 30 years or more. That approach to policymaking of redressing historic harms and focusing on the people who continue to be impacted by those harms is very relevant to our conversation today. Representative Clyburn has grounded his career in faith and public service, modeling civic duty and leadership. President Obama once noted that he is one of a handful of people who, when they speak, the entire Congress listens. And we were really ready to listen to him today. So thank you for being here, Representative Clyburn. Also joining us, as Patrick highlighted, is Wade Henderson, who is again leading the Leadership Conference on Civil and Human Rights and the Leadership Conference Education Fund, organizations he previously led for more than 20 years. The Leadership Conference is the nation's premier civil and human rights organization charged by its diverse membership of more than 200 national organizations to promote and protect civil and human rights of all persons in the United States. Over his career, Wade has worked diligently to address emerging policy issues of concern to the civil and human rights community and to strengthen the effectiveness of the coalition. Under his leadership, and I can tell you anybody in the social justice field can attest to this, the Leadership Conference has become one of the nation's most effective organizations in advocating for progressive civil and human rights policies. Wade is well known for his expertise on a range of civil rights, civil liberties, and human rights issues, and he's a champion for those who are excluded from our democracy. He was once the head of the Washington Bureau of the NAACP and worked with the ACLU. Thank you for being here, Wade. As Patrick laid out in his comments, Congress has the opportunity to fulfill the promise of the ACA by closing the Medicaid coverage gap and moving us forward as a country on the path to health equity and racial justice. There are so many Adrians in our country, and there is a moral and ethical imperative for us to address the Medicaid coverage gap. So I'm really excited to moderate this conversation today, and let's get started. And I'm going to start with a question to Representative Clyburn. Representative Clyburn, you have been vocal about the importance of Congress passing a law to close the Medicaid coverage gap in the 12 states that have refused to expand Medicaid. And it's important to note that these states could still expand Medicaid today if they wanted to. And in fact, they actually have more resources to do so because of the American Rescue Plan Act. Can you talk first about why it's necessary that Congress pass a policy to close the Medicaid coverage gap once and for all?
First of all, thank you very much for having me. And let me just respond to that question this way. I always view history as a great informer of how we ought to conduct ourselves as a country. And the history is very clear. If you look at those 12 states that refused to expand, the vast majority of them are in the South. Now, this is where the tradition has been that quote unquote states' rights rule, and states take the right to deny voting rights, educational opportunities. And they do the same thing for what we might call health and medical attention as well. Those states are never going to expand Medicaid, at least not in my lifetime. And so I think it's incumbent upon us, with the opportunity we have with this Build Back Better agenda, to just get rid of that coverage gap. And we can do that with this legislation. I think we should. Now, when I first started discussing this, I reached out to a senator from a state that I won't name, and I told him that I was going to be forcefully contending on behalf of this issue. Of course, he was from a state that had expanded Medicaid, and he said to me, "Why should we give South Carolina a pass?" I said to him, "You are a United States senator. You happen to be elected by the people in your state. I am a United States congressman. And I'm not just a congressman for the 6th congressional district. I'm here for all the people of South Carolina and other people in these United States of America. And I think it's an incumbent upon the country to do what is necessary to expand or to get rid of this coverage gap and to provide health care for all of our citizens. And it's the same thing for voting. Wade knows that we're fighting. All states do not conduct themselves the same way. And so we have to view this as a national problem and not allow healthcare to be meted out based upon not just what zip code you live in, and that's a problem as well, but what state you live in. Of course, that would determine your zip code as well.
Thank you so much. So on that notion of history as a great informer, Wade, you recently wrote a blog entitled "A Racial Equity Test for the Build Back Better Package." Can you explain what you meant by that phrase and why closing the Medicaid coverage gap is a priority for the civil rights community?
Well, thanks for the question, Emily. And let me say at the outset what an honor it is to be with you and Community Catalyst and Congressman Clyburn and our friends at the Center for American Progress, Patrick Gaspard and others. Such an important program. First, I think it's really important to recognize that closing the Medicaid coverage gap is what I call the sleeper civil rights issue of the president's Build Back Better program. You know, access to healthcare is actually a civil and human right. Nothing has made that more abundantly clear than the last year and a half of living under the COVID pandemic, which has exposed existing inequalities, racial inequalities in access to healthcare. It has become, of course, one of the most important issues because of the incredible consequences of the failure to provide adequate health care for all of our citizens. First of all, let's say it has been especially destructive in communities of color. And we have seen, of course, the importance of addressing what we see as profound inequity. The Medicaid coverage gap, as we're talking about today, affects 12 states, 8 of which are in the South. In those 8 southern states, about 60% of those not exposed or not given health care are people of color, African American, Latino, Native American, and Asian Pacific American. They are 28% Black, 28% Hispanic, and the remainder are made up of these other groups. And in these 8 states, you have such profound inequalities. In Texas, for example, we have over 400,000 individuals of Hispanic background who are not given adequate coverage. So what we're really talking about here, and by the way, we're talking about the working poor. We're talking about, in many instances, people with families, with children, with jobs. They happen to be 138% below the poverty line, but or around the poverty line. But what's most important is that there is a racial dimension to the inequality that exists. It is a structural inequality. We're not saying that individual states have the intent of specifically discriminating against people of color, but what we are saying is the nature of the policy choices that we have made as a nation and as a state has resulted in disparate treatment of people of color and access to essential healthcare services, and that denial has dire consequences for those communities. So yes, I think that this is an issue that very much addresses the racial equity agenda of this administration. And I know that President Biden has been especially sensitive to that concern, and I hope that sensitivity is reflected in the final choices of Congress around how to address healthcare needs.
Representative Clyburn, Patrick opened up with a really, I think, grounding story about Adrian, and it really elevated the human cost that the refusal of these 12 states has rendered in our country. And I know you're familiar with these stories. You've commented in the past on the importance of, as a principle of faith, centering people who are most suffering in our country, who have been most excluded by policies and programs. Can you share how the lack of Medicaid expansion has impacted families and communities in South Carolina? You're on, Representative, you're on mute.
Do you hear me now?
Yeah.
Okay. I think the biggest issue, rural hospitals. South Carolina, we've closed 4 in the last 10 years. I was on with yesterday. I think that Georgia has closed 9, or maybe 7 in Oklahoma, 9. These rural hospitals would still be open today if these states had expanded Medicaid, because the resources that are necessary for people to receive health care, they would get it. We could get to individuals, but I cannot think anything more comprehensive than having a hospital closed and having people needing to go miles away for health care. I think the same holds true for community health centers. I've also been proposing that we should have a community, federally qualified community health center within commuting distance of everybody in the country. And I just, we have to be comprehensive in our approach to this. Broadband itself is going to play a big role in this. Community health centers and with telehealth and telemedicine, all these things are going to be very, very important. And so none of these things can really function unless we have a comprehensive approach to dealing with this. Now, when I think about Medicaid, and I think about the Supreme Court decision, I think about the day that we heard. I remember we were in a caucus meeting when the word came that the Supreme Court had just said that the Affordable Care Act was in fact constitutional. Everybody was ecstatic because nobody had read the opinion. And by the evening when we read the opinion, many of us knew what the Supreme Court had just done was once again set up a big states' rights issue that would have adverse impact on people of color. And that's what Wade was talking about. That's why Martin Luther King Jr., back in 1966, spoke to this issue when he said that the greatest inequality, I think is the way he said it, among us was the unequal health care for inequality that exists in health care. That's still there. And irrespective of what the Supreme Court decision may have looked like, the effect of that decision is to set up a dual system, one in the parts of the country where people have a little history that's different from another part of the country. And that's why we have this problem today. If we do not do it at the federal level, it ain't gonna get done in states like South Carolina. Just remember, we're talking about states that used to pay from their state coffers for people of color to go to school somewhere else, rather than provide the education themselves. They reinforce that by paying you a stipend to go get that degree you want, law degree, for instance, in another state. And so they're still doing the same thing.
Thank you. And I have to share that at Community Catalyst, we actually have the quote of that Martin Luther King quote about the greatest injustice, one of the greatest injustices being lack of access to healthcare in our offices. So as when people come in, including our staff, we're reminded of the why of our work and the connection to health justice and the broader fight for race equity. Congressman, I know you have to leave at 10:30, so I want to make sure that we are getting some questions from some of our audience to you. So the first is a question from Alice Miranda Olstein with Politico. And she is saying that she's asking if you're hearing of pressure to cut back on the Medicaid gap provision if the top line number in the reconciliation bill comes down, and whether or not you would be open to a later start date or other changes to trim the cost.
Well, yes, I'm open to anything. You know, I'm one of those people who believe that we have to take into consideration the fact that you don't get the whole loaf every time you start out. I really believe that. You know, a lot of things that we call the Civil Rights Act took place over an 8-year period. In 1964, we got the Civil Rights Act. We didn't get voting until 1965. We didn't get housing until 1968. And the Civil Rights Act itself that outlawed discrimination in employment only did so in the private sector. It didn't apply to the public sector until 1972. So over an 8-year period is what we did. So my whole thing is, I'm not going to say, let's not do the coverage gap because we can't do it for the 10 years that I would like to have it done for it to be considered to be permanent. If you only get it for 5 years, then that gives me 5 years to work on the following 5 years. So yes, I will consider a budget coming forward that give me only 5 years rather than the 10 years that I would like to see. I also think, though, that we have to look and see what's happening with Medicare. We are talking about lowering the age requirement, which is great for me. If you go from 65 down to 62 for Medicare, that's great for me. I mean, I'm already over 80, but this ain't going to affect me personally. But I know what the actuarial charts say about people of color who stand to live longer. So people of color will get more Medicare if we drop it to 62. So I'm all for that. However, I don't want to sacrifice low-income families in order to take care of low-income seniors. Let's treat them all the same way. So yes, I'm for doing all of that. I'm not anyone that will ever sacrifice that which is good on the altar of perfection.
Thank you. And I have another question, and I think this is also for you, Congressman. What are some of the examples about how individuals on the ground can aid in the push for Medicaid expansion? And this is from the Sisters of Charity Foundation of South Carolina.
Well, they do a great job, and I want to thank them for the things they do in South Carolina. I wish I could tell you what to do in South Carolina to expand Medicaid. If I knew, I would have done it already. I don't know what we can do beyond keep pushing the envelope on this, keep getting people involved in this. As many people as we can bring into this process, the better off that we are going to be. And just so you know, I'm not getting off at 10:30. Since we've been here, I got a notice saying this issue is before the leadership committee just below me today. I am not going to be out of that room because I suspect that I'll lose this argument if I'm not there to make it. So that's what's on the table right now in the leadership meeting, what to do by Monday morning on this coverage. And Wade would be upset with me if I stayed on here with you and lose this issue in that room.
Please go to your meeting, Mr. Clyburn. Thank you.
Thank you so much.
Thank you, Congressman. So Wade, let me turn it to you. I would love for you to expound more on why this moment in particular is so important. Obviously, the congressman having to leave so that he can fight this good fight in the halls of Congress is one signal of the moment that we're in, but it would be great for you to explain more why right now is so important to get this.
So Emily, let me put it in a bit of context first, and then I'm happy to answer your question. You know, in the 12 states that have not expanded Medicaid coverage, we have 2.2 million low-income people being affected by their denial of access to health care. Of those 12 states, 8 are in the Deep South. Florida, Georgia, Texas, Alabama, Mississippi, North and South Carolina are all in the Deep South. These states have a common history in 2 significant respects. First, these are states with a history of racial discrimination, such that until the Supreme Court spoke on the issue in 2013, literally gutting the Voting Rights Act, these states were covered by the pre-clearance provisions of the Voting Rights Act, which meant they needed to submit any changes in their election procedures to the Department of Justice before they could implement them. When that protection ended, many of those states immediately adopted additional restrictive voting procedures that to this day have made it harder for people of color to cast ballots in those states. The struggle right now over the passage of the John Lewis Voting Rights Advancement Act and the Freedom to Vote Act that has just been introduced in the Senate relates to the kinds of changes that we are seeing in election procedures in those states. Those states also have a history of adopting restrictive efforts now on access to healthcare. We have seen, for example, in Texas, the adoption of a new restriction on reproductive health, abortion, that is likely to be replicated in states throughout many parts of the South and in other regions of the country as well. So those things are in common. And I mention them because in those 2.2 million people, as I said, in those 8 southern states, you have a remarkable presence of African-American and Hispanic citizenry. In Florida and Texas and Georgia together, each of those states has over 100,000 African-Americans apiece. In some of those states, they represent both Latino and African-American, about 60% of those denied access to healthcare, even though they are only 41% of the population. So my point is that this issue, this denial of access to healthcare, has a significant and profound impact on communities of color And one last factor is that these states have also resisted common sense, reasonable health mandates related to COVID and protecting its citizenry from COVID. So what you now have are states that deny mandates, deny wearing masks, and have exacerbated the exposure of their citizens to COVID infection. You now have hospitals overwhelmed with COVID patients and nowhere for their citizenry to go. And even when you have a place to go, you don't have the resources necessary to take advantage of healthcare. So that's the context in which we're talking about. And that's what makes it such a profound and important civil and human rights issue. Now, why now? Well, obviously, Congress is tackling the most important questions facing our country in rather since FDR and his administration. Because this question of physical infrastructure, bricks and mortar, is so clearly behind the 8 ball that if we don't begin to take action almost immediately, our country will fall apart. We've seen that with collapsing bridges. There are tunnels like the tunnel going from New Jersey to New York that's about to collapse. I mean, we have some profound problems, but we also have problems in human infrastructure. And access to healthcare is perhaps the most important. Now, I very much appreciate Mr. Clyburn's pragmatism. It has served us well. But at the same time, I think that as we are looking at this issue of healthcare, this is a once in a lifetime opportunity, because he is absolutely right. Of the 12 states that don't have Medicaid expansion now, those 8 southern states are unlikely to voluntarily accept an expansion of their health system. And because in many instances, the electoral system itself has been manipulated and will exclude voters, the likelihood that voters will use their power to overturn those restrictions become more difficult unless we can address the voting issue as well. So voting, COVID, and this expansion of Medicaid coverage gap go hand in hand. And if we don't seize the moment, Emily, then I think we will have done the nation and the constituencies that we represent a profound disservice. So that's why now.
Thank you for that. And, I want to ask a follow-up question because you've spoken obviously so eloquently to the health and race equity context of this, the public health emergency of this, and the moment, the opportunity, and situated in the context of, as Representative Clyburn mentioned, the how history informs, and you get these windows in time to make big things happen, and they don't stay open forever. So coming back to this notion of using that, leveraging that window, how important is it to you that the Medicaid coverage solution be permanent and comprehensive? And if so, what does that mean?
Well, it is necessary that this become a permanent program. I mean, I think anything short of permanence insofar as the federal program is concerned injects a level of insecurity in the system, which ultimately will affect the willingness of states to implement it under the guise that, look, it's not going to be here indefinitely. We really don't have to comply. And they will drag their feet in denying services to those most in need, because they will be able to save small amounts of money, which from their perspective will be done on the backs of the poor, and that's okay. So it does have to be a permanent program. Now, I think we can make it a permanent program. I think the momentum is there, and really more than political momentum, the evidence is there to create an argument, a compelling argument. You've heard some of the data today. When it is presented in the rooms where decisions are made, comparing an investment in Medicaid coverage in comparison perhaps to other important needs will show that, the kind of empirical data that we present speaks for itself. Now, the other problem is this, Emily. Those who would most benefit from this program are not able to raise their voices in places that make a difference. You know, Patrick Gaspard opened this morning with a very powerful story of Adrienne Gunter. And he talked about her experience in trying to secure health coverage in Pennsylvania. It was only after Governor Wolf expanded Medicaid over the objection of some of his Republican state legislators was she able to get the health care she deserved and needed. There are Adrians throughout the country. They're Black, they're Latino, they're Native American, they're Asian and Pacific American, they're poor white who are suffering daily because they have no access to health care. And I would say when you add to that the fact that, as Mr. Clyburn mentioned, the closure of rural hospitals. Let me say, hospitals throughout the country are closing their doors, making it all the more difficult for the people we're talking about to gain access to health care. Expanding Medicaid would also help those institutions survive. It would provide a lifeline that would help support those hospitals in ways that allow them to serve the communities where they're situated in ways that without Medicaid expansion, they will not be able to do. So what I find so especially galling is that many state governors who refuse to accept this expansion reject it on the basis of federal intervention in state affairs. And yet the costs of our failure to provide adequate access to healthcare become a national problem. Because when you have ICU units throughout the country filling with COVID patients, such that other patients who would otherwise receive service in those hospitals are forced to go elsewhere, putting a burden on other states. When Idaho can't meet its demands, or Montana and their citizenry go to Washington State for treatment, Washington State bears the burden. This has to be a cost that is leveraged in part by what the federal government can do. And it's only through a program like this, made permanent, that, in my view, do you get the benefits that we're talking about. So I think we have to struggle to accomplish that result.
Thank you for that. And first of all, before we go to additional questions, I do want to remind folks that if you want to submit a question, submit it to the Q&A. In just a minute, I'm going to invite Maura Kalsby from the Center for American Progress to join us to help answer some of the policy questions that we're getting. And before I do that, I just want to lift up some of what you've been highlighting in terms of all of the data out there. Over these last years, since the Supreme Court said that expanding Medicaid should be a choice, there has been a lot of research and writing and reports written showing exactly what you outlined, how this saves lives, how it's important for making sure people still have access to hospitals and healthcare systems, and those provider systems, particularly in rural areas, can stay open. There have been studies around maternal health and the way in which Medicaid expansion and postpartum coverage is important for people of reproductive age, and critically important in particular for Black maternal health. And importantly, I think, as you pointed out, with respect to Texas, 1/3 of people in the Medicaid coverage gap are people of reproductive age. And I have to say, every time I am reading those reports, of course, they're incredibly helpful in terms of grounding the policy rationale of it. But there's also some part of the equation here that is just about values and the heart and soul of our country, and who do we want to be? What do we want to uplift as a nation? And I think on that score, and since you mentioned Adrienne, I do want to come back to this question that came up about what people on the ground can do to try to shine a light on why now, why this is so important. So I would like just to ask you, for those folks who are listening in and who are working for organizations on the ground, or who are individual community leaders, to get your insight on, in this moment, these next critical 3 weeks,
Yes.
What's the work that they can do to make sure that they are supporting the broader effort to get this policy included in the infrastructure package?
It's a great question, Emily. First, let me say, personal stories of individuals struggling to provide healthcare for themselves and their families are very powerful. As we heard with Patrick's discussion of Adrian, it can be very powerful. It can move a room. Individuals who don't have access to healthcare and who have suffered grievously in their home jurisdictions often don't know the process of advocating on their behalf with members, their elected officials. So certainly it seems to me that while Congress is considering these questions, focusing one's effort on congressional representation is key. Mm-hmm. Organizations like the Sisters of Mercy and others who engage in delivery of services and who themselves advocate for change have an opportunity to help marshal forces together to meet their members of Congress, their senators, their representatives, and bring with them some of the people who have experienced the greatest difficulty and share those personal stories. Advocating with the editorial boards of your local newspaper, helping them understand that this issue, which they perhaps know nothing about because it hasn't been discussed publicly, that's why I call it a sleeper civil rights issue. It's just below the surface. They should talk with editorial board writers. They should try to identify who might be the healthcare reporter in their local paper and talk with them about these issues and to try to get their voices raised. You should talk with the business community, the Chamber of Commerce, and others who recognize that a failure to provide healthcare for the majority of citizens in their communities has a direct impact on the quality of business and the economic growth of the area. And they can be perhaps mobilized to help in delivering this support. Recognizing that it is the federal government that is making the greatest investment and doing it now is an important incentive to get them to add these issues together. So I would say that grassroots organizing at the local level, directing one's voices toward elected officials in Congress, and doing it in a multiplicity of ways, trying to mobilize different constituents, the NAACP, and yes, the League of Women Voters, and yes, the National Urban League, and yes, Unidos US, and women's groups like Planned Parenthood, and the National Partnership on Women and Families and others should be at the table collectively. This is a time for coalition politics. If you're not practicing the politics of coalition, you are not practicing the politics to win in the 21st century. Recognizing that these poor people should also be registered to vote and to be encouraged to turn out in the next election cycle to vote for their interests. This is a chance to educate more broadly than we have undertaken previously. So I would say that recognizing that there is intersectional linkage between different movements, and recognizing that if those movements use their voices to persuade their members of Congress to support this undertaking, it is time well spent, and it is using the system. The motto of the Leadership Conference is, we are working to build an America as good as its ideals. And healthcare and access to healthcare is an American ideal that needs to be elevated to the highest level.
And health is a right to.
Absolutely.
Yeah, absolutely. So I definitely want to take a step back because we got a question from Carl Polzer, and Mara, I think maybe you could start with the answer, and then Wade, would love to hear your thoughts on this. There's a question that's more focused on, wait a minute, help me just make sure I understand. What does it look like for the federal government to fill the Medicaid coverage gap? Is this a new program? Are we changing the Medicaid program? How would this come to life in the policy?
Well, I think that you have to think about it in two steps. The first step is, yes, this would be a federal Medicaid program that's going to take a little bit of time to get up and running. There's a lot of, just operational things that federal policymakers will need to do. But in the meantime, there are different ways for people to get coverage. So immediately after enactment, people will hopefully be able to enroll in the ACA's marketplaces. And there's already plans available there, but those plans will be no cost. We will make sure that people also have there are some different pieces that Medicaid covers that Marketplace doesn't. So I think federal policymakers are making sure that those services are also included.
Great, thank you for that. And I want to pick back up on this notion of that Wade was highlighting about this being a moment of coalition building, and build on this idea of organizations that come to the table and come to the fight for justice from lots of different perspectives, whether they be reproductive justice or fair wage or labor or race equity. I would love to hear both of you talk more about, how could that come to life, in particular for those organizations that are working in states and communities that are not impacted by the Medicaid coverage gap. So if you're a state organization or a local organization in Washington State or California State, what are the ways in which you can be talking about the importance of and supporting the effort around this policy?
Maura, why don't you go first? I'll follow you.
Sure. Well, I think this event alone shows the importance of this issue and different groups that all care about this coming together and working together to spread this message. I think that a lot of what Wade said about what folks on the ground in states that really need this expansion really applies to those who are in states that have already expanded. So, making sure that you are contacting your member of Congress, making sure that you are really telling them that you care about this issue, that it is a matter of racial justice, it's a matter of health justice, and just because you have health insurance doesn't mean that the game is over. We need to press forward and make sure that we're all in this together. Medicare covers everybody in this country, regardless of the state. Medicaid should as well.
Maura, I think that's absolutely right. But I go back again, Emily, to the power of stories, of personal stories. Patrick's elevation of Adrian this morning. She lives in Pennsylvania. Pennsylvania has expanded coverage. But her story is powerful and should be shared with members of Congress who are contemplating their vote on this issue. How will they vote for it? What will they do when reconciliation has to be determined? Will they support the expansion of Medicaid coverage? Certainly hearing from people in their states who have benefited from the expansion and who can tell stories about what it means for themselves and their families and help educate members of Congress in a very personal way about how the impact of this expansion has affected their lives, I think have power. So I would go there, number one. Number two, I would say, even when your state has health care and you don't know someone like Adrian and you can't, take them to a member's office, work on those voting rights bills, please. The Freedom to Vote Act and the John Lewis Voting Rights Advancement Act are directly related to this question of expanding Medicaid coverage in states that now won't take it. So that's number two, encouraging people to vote, registering people who are not registered, getting them committed to turn out in the next election, regardless of party affiliation. I mean, voting is the issue. And I would say to you, those concerned about reproductive health, the same argument. Register voters and get them engaged in this process. And then I mentioned coalitions. I mean, in many of these states, you already have coalitions working on voting issues. You have coalitions working on the expansion of broadband. You have coalitions that are addressing reproductive rights. Those coalitions representatives of those groups should interact with one another and explore ways that they might collaborate in focused efforts to educate members of Congress about the importance of this issue. So this is really about how effectively we can organize at the state level to make our voices heard and to use creative approaches to educating members of Congress. This is not, at this point, about money or who's in the best position to who knows the congressman best. It's about mobilizing people in a grassroots. The power of grassroots advocacy should not be underestimated. And I think it has real impact on an issue like this, and we should encourage it.
Thank you for that. So I have, I think, a related question for you, Wade. You've talked throughout this conversation about, in lots of different ways, the connections between the fight for voting rights, for reproductive justice, for health equity and advocacy, in particular, the connection between voting rights and health equity and in the context of this Medicaid fight. Can you speak more about what you see as the connection between a person's ability to get health care, to be healthy and well, and then their ability to civically engage, to vote, and to be a part of our broader advocacy efforts?
Yes. Healthcare, access to healthcare is the most important and fundamental of the civil and human rights that we're talking about. If a person is not adequately, sufficiently healthy in their own person, then nothing else really matters for them.
Right.
If they have chronic illnesses that are debilitating in nature, if they have what are called comorbidities, previous infections that make them vulnerable, in states that don't mandate vaccines, don't encourage the use of masks, as has been said by many health experts, if you are unvaccinated, COVID will find you. It's not a question of whether, it's just a question of when. It will find you. And in those states, you have people, those are the states that we're talking about in many instances. So, healthcare, access to healthcare is the most fundamental, the most important of the civil and human rights, because nothing else really matters if you are not able to adequately protect your health. And so, and I think this is one country. In other parts of the Western world and other representative democracies, healthcare is recognized as a right. Here, it is considered more of a privilege, and under the control of states that, for whatever reason, choose to ignore the opportunity. It has, disastrous consequences. Your health should not, as Congressman Clyburn said, depend on your state or your zip code. You should be able to have that because of it. And, look, we talked about life expectancy. It is not, of course, a surprise that African Americans have a lower life expectancy than majority whites. And there are many factors there. But structural racism has contributed to that problem. Access to Medicaid, expanded coverage, has reduced racially tinged health disparities in significant ways. And that is a good thing for this country. It's a good thing. And we should encourage it. And recognizing that our policy choices in the past have created some of the results we're grappling with today, the policy choices we make today will shape the America that we will become in a decade or two from now. And that's why it's so important to seize the moment. Emily, seize the moment. And this really has to be the moment that we are talking about.
Absolutely. So I have one final question, and it's about those southern states, those traditionally politically red states that actually have expanded Medicaid. So Arkansas, Kentucky, Louisiana, Virginia. What lessons do we have in terms of that expansion for our country and for other states?
I think those states offer a very important lesson to their fellow southern states, but to the country as a whole. That simply because you have supported previously policies that have created the current challenges that we face today, you can overcome those challenges by taking progressive, intelligent steps to expand opportunity for your citizenry. We're not talking about for the country as a whole. We're talking about the citizens who live within your borders. So states like Virginia and Arkansas and Kentucky are able to show through, again, an examination, Emily, of empirical data, how the health conditions of their citizenry have improved during the period of Medicaid expansion. I would hope those studies are being made available to other states in the region, because this is not the equivalent of New York coming to Alabama to tell Alabama how to handle its healthcare challenges, or Georgia or Texas. This is about fellow states like Arkansas and Virginia sharing their information so that you can understand the impact of the expansion program on their states. And you may see some comparability that might encourage you to pursue a similar direction. So I think that, these governors, of course, don't proselytize among themselves on these issues, and perhaps that's best. But I think the evidence of how well their states have done should be shared broadly. And I think those stories should help influence decisions that the current leadership of those states make.
Great, thank you. Imara, do you have anything to add on that?
I would just add, backing up to what Patrick said at the beginning of this and what Wade has mentioned throughout it, I think the power of the stories of people in these states also are very, very important. And I think that I just keep going back to last spring when everybody was, out there at 6 o'clock in the evening, clapping and banging pots and pans for essential workers and health frontline workers. I mean, these are the essential workers that we're talking about in these states. And I think that, in order to really do justice and, actually have action and not just platitudes, we need to get this across the finish line. We need to make sure that regardless of where you live, you are covered. And that also, I'm sorry, I just want to make one more point, is it's not just a health equity question. It's also, it prevents evictions. It reduces medical debt. And it's just a whole of, it has so many implications beyond just getting the healthcare you need. It's financial stability for these essential workers. So with that, I will turn it back to you, Emily.
Great, thank you so much. And this has been such a rich and important conversation as we witnessed in this dialogue at such a critical time. And I just want to close with, two really important points that were made. One is the point that Wade has made about the essentialness of us seeing this and recognizing this as a sleeper civil rights issue in this package, and shining a bright light on that. And the second is what Representative Clyburn highlighted about letting history inform. And that, I think, is both with respect to the why this is so essential, as well as the why now. We have moments in time where we have an opportunity to do something big, and this is it. And that's why Community Catalyst has been so grateful to partner with the Center for American Progress, to partner also in many, many ways with the Leadership Conference, and grateful to be in this conversation with all of you. So thank you, and have a wonderful day.